So I wanted to go over a concept here that is super important for dentistry, specifically for removable prosthetics. Um, it's really important that we realize that all post-operative appointments really cut into our profitability. And you're going to find that this is really the case in all dentistry, that if you're not doing a good job or if your clinical dentistry isn't up to par, you're going to spend a lot of time in the post-op trying to get things to fit. And so really you need to work on making every aspect of your impressions, your dentistry just as perfect as possible so that you can reduce your post-operative time in the chair. Okay, and we'll show how this works quantitatively. But for dentures, we learn in dental school the 5 visits, going from primary impression to a secondary impression with a custom tray and PVS, then doing the VDO appointment, getting their vertical dimension of occlusion, and then going through an aesthetic try-in, and then to a delivery. A lot of times doctors are trying to shortcut that process, and unfortunately what they find out is, yes, you might be able to get away with less than a perfect impression. Yes, you might be able to get away without a secondary impression, but what ends up happening is you do more post-op work so that it ends up not saving you any time, and in fact it actually costs you more time versus just doing it perfectly right up front. Okay, so I'll kind of show you that quantitatively. As far as time frames, if you have someone who really wants to get it done, you can have the patient sit in the operatory while you take the primary impressions, make the custom tray, and then get right to the secondary impressions on that same visit. Yes, it's a little bit longer of a visit, but for patients who are traveling from a long distance or are really under a time crunch, it's best to get those 2 appointments done at the same visit. As far as when you go to the VDO and you order your record bases, that is super important to that is your first visit where you're getting a lab fee. So all the time I'm submitting my claim for the denture on this secondary impression, okay? And if you kind of just standardize on submitting all of your cases on the secondary impression, it allows for a couple of things. First of all, it allows you time for insurance companies, for example, Colorado Medicaid, that need a pre-authorization. You can take the primary impression, get the patient scheduled out a few days, and then when the secondary impression is ready to go, you can walk the case out there, okay? This delay between the primary and secondary impression is used a lot when you do a full mouth extraction. Then you'll take the primary impressions about a week later, and then you basically reevaluate the healing a week at the primary impressions and decide when you're going to take the secondary impressions. If you'd only taken out a tooth or two, hey, maybe you take the secondary impressions the next day. If you did a full mouth extraction, there's a lot of healing to do. Maybe you send out the secondary impressions or you order the secondary impressions a lot later. Okay. Another thing too is when you are doing these impressions, a lot of times too, if we're going to be doing an immediate denture or what we call a hybrid immediate, which is we extract the posterior teeth and then wait for everything to heal, and then we come in and extract the anterior teeth and do the delivery on the same day. Obviously, we're going to go from secondary impressions and then we're going to do a VDO, and then we go to a delivery, okay? So this aesthetic try-in appointment obviously is not part of that, okay? The other thing that we like to do also for insurance purposes is on the primary impressions, what we're going to do is we're going to do a limited exam and potentially take out all the teeth, and then we are going to do a full exam or a D0150 at the secondary impressions. That way you can break up those two exam types into 2 different days, okay? As far as the time frame in between those appointments, these are the absolute minimums, okay? But usually we standardize on the 2 weeks. So usually between primary and secondary impressions is a couple of days, and then between secondary and VDO is 2 weeks, 2 weeks, 2 weeks. So if you think about that, usually the whole denture process is between a month, month and a half, but you can shorten it to almost less than a month if you really, really push it. So just kind of understand those time frames. Now, like I was alluding to here, a lot of times dentists are trying to figure out ways to shortcut this process. And what ends up happening, unfortunately, is if you're trying to, create dentures off of primary impressions, what'll happen is when you get to the delivery, you'll think, oh my goodness, I have everything ready to go. Maybe even the VDO is perfect, but then the denture is not fitting as well as it could have. And you spend a lot of time worrying and stressing about how can I get this denture to seat and have suction. And you'll try soft relines, hard relines, and whatnot. When in reality, if you would have just done the secondary impression with PVS and a custom tray and been super particular about what it looked like, you would have shortcutted all of those post-op appointments with the delivery, okay? So I think every dentist in the history of dentistry has tried to shortcut these two appointments and ended up coming back to doing these because they found out that there's just so much post-op at the delivery. And you'll see this in the aesthetic try-in appointment video, where the patient she wasn't jumping out of her chair saying she just loved the fit of it, and she had very little bone to have stability of her denture. But I was very, very confident that there was nothing that I could have done any better because my primary impression was perfect, my custom tray was perfect, and my impressions at my secondary impression were perfect. And so I'm getting her the absolutely best denture that she could have. Usually with the primary impressions, we're going to do it with a stock, or if you're really wanting to do it very well, you'll do it with an edentulous tray. The secondary impressions are always done with a PVS, with PVS and a custom tray. And that custom tray really needs to go down to the bottom of the vestibule. You'll see the video about how to create the custom tray and how we make sure that it covers as much area as possible, okay? But quantitatively, let's just take a look at here. And I've just come up with a couple of examples, and this might not be applicable to your state, but it gives you some ranges of prices of dentures, okay? So in Colorado, the Colorado Medicaid fee or amount that we're going to receive is about $1,500. The lab cost is about $270 per arch, so $540. Assistants, let's say they cost $20 an hour. If we do it just the normal way, we're going to have 5 visits and maybe 3 post-op visits, okay? I tell every patient, I expect you to be in here 3 to 4 times over the first month. So let's say it's 3. If you take that, the profit per visit, if you come with this formula, is $1,500 minus the $450 lab fee, minus essentially another 8 appointments costing $20 an hour on the assistant side. Our profit per visit is $100, okay? So think about it with Delta, okay? Delta, let's say that we have a $2,100 fee, same thing. Everything goes super smoothly. Every one of those visits, a profit of $100. Now, when you look at this, if you do one filling, you're going to be making way more than $100. So these denture appointments are very much not the most profitable appointments, even at Delta fees here, okay? So you really have to understand that you have to make these appointments as efficient as possible, and you have to make sure that you don't increase the post-ops, okay? So now let's take a look at this. Let's say that we don't do a very good job and we're not super particular with our dentures, okay, and we require more post-ops. look at the profit per visit, how that just drops significantly from $100 to $67. I mean, we're less profitable than a prophy at this point, okay? On the Delta side, here we are, we're about 121 bucks, okay? But let's say that worst case scenario, we don't do a good job on any one of these steps, okay? And we have to go into a redo, which has happened to every single one of us who's done dentures. Oh, something didn't fit. The aesthetic try-in wasn't perfect. The fit wasn't perfect. Hey, we'll remake your denture. Guess what? You have to go through 10 visits with 3 post-ops. Guess what? And you're probably not even looking at 3 post-ops. You're probably looking at 6 post-ops. Why? Because you probably tried to get it to fit. It never fit. Then you had to remake the denture, and then you had to do your 3 post-ops afterwards. Okay. So really, this is probably a 6. So now you're making $40 a visit. You are not making any money at all on those particular ones. And obviously, I haven't put in chair time and time away from other things. So, these are just looking at those. So you will see here, and you will see through the process that, and all dentistry is like this. If you can work yourself to expect and to perform very good to perfect dentistry all of the time, it actually takes less time than if you did it wrong or if you allowed less than perfect dentistry. So the goal here is to do everything perfectly, do not skip steps, and at each step, make sure that you're super particular with assistants. My experience is this: when you get a new assistant, they're going to come to you probably the first 10 times, and it's going to be not perfect. And you need to be able to step in if they can't get it by the second time, okay? Because you don't want the patient to have to take an impression 3-4 times, okay? So if they don't get it right by the second time, then you come in and you as a doctor should be proficient in doing all of these steps yourself and showing your assistants how to do it. The other thing too is if you become lackadaisical with your assistants and you allow them to start being lackadaisical with their requirements on these or not doing each step perfectly, you are going to always not like removable because these post-ops will be so much more difficult, and it's very difficult emotionally to walk into a patient and say, you know what, we didn't deliver the best that we could have. So again, do everything that is absolutely possible to make sure that your dentistry is in the very good to perfect range every single time, and your stress level and your patient clinical outcomes will be perfect.